Assalamu alaikum. I'm Shizali. My roll number is BP1650210 from 5th Prof Morning. The drug which was assigned to me by Madam Shahana is hydralazine. Hydralazine is an antihypertensive agent which acts as a vasodilator. It relaxes and expands blood vessels, eventually lowering the blood pressure. It also serves as antioxidant. It has been available for many years, though it was initially thought to be not much effective because tachyphylaxis to hypertensive effects developed rapidly. As for now, the benefits of combination therapy are recognized and may be used more effectively, particularly in severe hypertension. For example, it is given with the isosorbide nitrate in cardiovascular diseases. It can also be paired with beta blockers or diuretics if the patient is not able to tolerate hydralazine alone. As we can see, when the blood pressure of the patient is elevated, there is a lot of pressure faced by the blood vessels and heart being overworked, and if remain untreated, the disease can lead to atherosclerosis and congestive heart failure. With no hypertension, heart pumps normally and blood flows easily through the vessels, and in hypertension, heart has to pump harder. Indications: it is primarily indicated in conditions like benign gastric and duodenal ulcers, heart failure, hypertension with renal complications, and hypertensive crisis during pregnancy, hypertensive emergencies too. Moderate to severe hypertension, severe to recurrent duodenal and gastric ulceration. It can also be given in adjunctive therapy as an alternative drug of choice in heart failure, as I mentioned before, with long-acting nitrate, isosorbide dinitrates. Side effects of this drug includes headache. It can cause tachycardia, so pounding and fast heartbeat, loss of appetite, nausea, diarrhea, dizziness. If any of these side effects last or get worsens, person should immediately go to the doctor or pharmacist. Contraindications: hydralazine is contraindicated in conditions like angina because it is a potent vasodilator, and it can cause reflex tachycardia, which can worsen angina. Rheumatic mitral valvular heart disease, hypersensitivity. Mitral valve rheumatic heart disease because hydralazine can increase pulmonary artery pressure. Dose variations: for normal adult dose is 10 to 50 milligrams per oral as recommended, or every 6 hourly. Neonatal 0.25 milligrams to 0.5 milligrams per kg per oral 6 hourly, and it can also be given 0.1 milligrams per kg intramuscular as recommended. Drug toxicity: if anemia, leukopenia, agranulocytosis, and purpura develop, the drug should be discontinued immediately. Hydralazine is used alone or in combination with other medications to treat high blood pressure. This is the rational use of drugs. Thus, it lowers the high blood pressure, helps prevent strokes, heart attacks, and kidney problems. Hydralazine is actually a vasodilator. It works by relaxing the blood vessels so blood can flow through the body more easily. It is also used for treating hypertensive crisis and congestive heart failure. Irrational use: it should be used with caution in patients with coronary artery disease, cerebrovascular disease, severe renal damage can occur. Doctors continue with therapy without monitoring complete blood count at baseline and periodically during therapy. Patients that age between 18 to 60 with no other medical condition, when hydralazine is taken by them, it stimulates cardiac muscles, which may cause chest pain or angina attack. Hydralazine is sometimes prescribed to the patient as first choice, but Instead of it, diuretic should be prescribed by the doctor, as that is the first choice for primary hypertension. Misuse of hydralazine is associated with higher risk of heart attack, therefore never to be prescribed in coronary artery disease. Alternative choices: as hydralazine is a vasodilator, we can also use for hypertension diuretics, angiotensin receptor blockers, ACE inhibitors, and beta blockers. Some of the names are captopril, enalapril, hydrochlorothiazide, lisinopril. Alternative brands is hydralazine 20 mg from Zypa Pharmaceutical Laboratories and Capotin from GSK. Available dosage forms are two, which is tablets and injection. Case study: Miss Amon is a 42-year-old brown woman with a 7-year history of hypertension, which was first diagnosed during her last pregnancy. Her family history is positive for hypertension, with her mother dying at 56 years of age from hypertension-related cardiovascular disease. In addition, both her grandparents, maternal and paternal side, also had CVD. As Eamon presented with complaints of headache and general weakness, she reported that she has been taking many medications for her hypertension in the past but stopped. She could not recall the names of the medications. Currently, she is taking 100 mg per day atenolol and 12.5 mg per day hydrochlorothiazide, which she admits to taking irregularly. Despite this antihypertensive regimen, her blood pressure remains elevated, ranging from 180 to 185 by 120 to 125 millimeters mercury. Physical assessments are unremarkable except for the presence of moderate obesity, minimal retinopathy, and a 25-year history of smoking approximately 1 pack of cigarettes per day. Her pharmacological regimen of atenolol and hydrochlorothiazide was changed to a trial of the angiotensin converting enzyme inhibitor enalapril 5 mg per day, which doesn't work. Soap notes: age of the patient is 42 years old and has a history of 7-year history of hypertension with family history of cardiovascular disease. Her complaint is elevated blood pressure with general weakness and headache. Current medication which she was taking 100 mg per day atenolol and 12.5 mg per day hydrochlorothiazide, which was then changed to ACE inhibitor enalapril 5 mg per day, and it also doesn't show much change. Objective is to control the blood pressure so that underlying causes will be cured. Tests recommended is serum electrolyte test and physical assessment. Taking into account the past history of compliance irregularities and the need to take immediate action to lower this patient's blood pressure, atenolol and thiazide should be discontinued as they are not affecting the patient's blood pressure. As patient does habitual smoking and has history of cardiovascular disease, thiazide diuretic chlorothiazide has to be discontinued as it may have problems with bioavailability. Plan: after 3 months trial for ACE inhibitor, the patient's blood pressure remained uncontrolled. The patient's medical status was reviewed and her antihypertensive therapy was modified. The ACE inhibitors was discontinued and the patient was started on the vasodilator hydralazine with the dose 10 mg per oral every 6 hourly for 2 to 4 days, then to 25 mg every 6 hourly daily for the first week. Then according to the results and readings, we can either go to 50 mg for second week or either adjust the dose to lowest effective level. It is recommended along with beta blocker. In addition, recommendations for smoking cessation, weight reduction, and diet modification is given. After 2 months of therapy with the hydralazine, the patient experienced a modest yet encouraging reduction in blood pressure. Conclusion: hydralazine is a more potent vasodilator than are the ACE inhibitors, and hydralazine is superior to the ACE inhibitors in terms of acute effects on cardiac performance. It is a vasodilator which relaxes smooth muscles inside the blood vessels, making them wider and allowing more blood to flow through. It decreases the force which heart has to exert to pump blood through vessels and reduces blood pressure. It stimulates the sympathetic system, which can cause tachyphylaxis and tachycardia. Patients tend to tolerate it better with beta blocker or a diuretic. That's why we moved from ACE inhibitor to hydralazine. References, and thank you.